Well, hello and a very warm welcome to the Scotland-Malawi Partnership SMP Water Forum. Principal Secretary for Water and Sanitation, Mr. Elias Chimulambe, Ministry officials, friends, all protocol observed. We're aware that the joint water sector review in Malawi is happening right now, so particularly appreciate everybody making time to join. I'm Stuart Brown, Interim Chief Executive of the SMP. May I please invite you to introduce yourself using the chat function in Zoom. Everyone is equally welcome and encouraged to participate in this member-led event. Member-led in that in a roundtable event last May, Dorcas and Gaia of Water Witness International shared some really important points about the cross-cutting nature of water relevant to everyone's working in the bilateral relationship. And that's what we're going to be exploring today. The significant outbreak of cholera in Malawi, of course, underlines the crucial value of equitable and sustainable access to clean water. Dorcas has led in the design of today's meeting. We're grateful to her, to Dr. Tracy Morris at the University of Strathclyde, and to all of our speakers from their institutions, from Water Witness, from Strathclyde, from the Government of Malawi, from WaterAid and from Baseflow. As you know, this meeting's being recorded so that it can be posted online afterwards. We'll share the chat log with all participants after the event, but if you have any direct messaging during this meeting, please remember to save that. We have a full programme, so please do support Dorcas, our chair, in helping keep to time by being succinct and making good use of the chat function to post questions and comments. It's a pleasure now to hand over to our chair, Dorcas.
Thank you very much, Stuart, and thank you for the warm welcome to all of our participants today. As Stuart rightly said, this is really a get-together, not just of the water NGOs, of water, agricultural and environmental people, but it's to get together with education, with health, with a multitude of other areas to look at the cross-cutting nature of water, its multiple dimensions, and how it impacts and is relevant to all of the members' work across Malawi. It's about building understanding, it's about opportunities to learn and future opportunities to collaborate. And what isn't it? It isn't grandstanding. It isn't about who's doing the right thing or the best thing. It's not competing for attention, because water is such a vast topic that there's a place for everyone. We're talking about water issues in Malawi today, but remembering that Malawi is not alone with its water issues. I'm not proud to say that raw sewage is being pumped into the rivers and seas in the UK here as we speak. So we've got a multitude of problems ourselves. As we said, introduce yourselves in the chat. We won't have time for everybody to speak, but we'd love to hear how your work links with water. So if you can pop that in the chat, that would be great as we go through the different areas of water. Please keep your spoken interventions short, as I will have to hear quite quickly, so I don't want to offend anybody, but I may have to jump in at certain points. Thank you. Now with that, I'm going to welcome the Government of Malawi's Principal Secretary from the Ministry of Water and Sanitation, Mr. Elias Chimulambe, who's going to give us the keynote speech. Thank you very much. Thanks. Over to you.
Right. Thank you very much, Dorcas, and thank you very much. I will present the cholera updates. I hope you are able to see the screen, my screen. If you're able to see, I can continue presenting. As we all know, we have a cholera outbreak, and it started in the dry season around March, and it has now rapidly spread in the rainy season. In December, it was declared as a public health emergency by the state president. And since the first case in 2022, all the districts in Malawi, about 28 health districts reported cholera cases. It means in all the districts in Malawi, we have a cholera case. We had experienced some cholera cases. As of 24th January 2023, a total of 30,621 cases has been reported. And out of these, over 1,000 deaths have occurred. translating to a case facility rate of 3.27%, which is above to the WHO recommended case facility rate. As we are speaking now, we have cases that are admitted in the treatment units, about over 1,115 cases. There are lots of factors that are contributing, associated, and escalating this outbreak. Specifically, poor food hygiene, poor sanitation. We have low latrine usage, safe water sanitation, safe water supply, and we have also challenges in terms of contract testing. This is the reports that comes every day from the Ministry of Health, and this is taken from Ministry of Health presentation. And if you look at where we are getting the case, the map shows exactly where the cases are concentrated. If you look at this carefully, you find most of the cases are concentrated in the lower part of the country and along the lakeshore, and also in the cities of Lilongwe and Blantyre, yes, and some areas around in the central region of Dedza and Salima. The top 5 districts that have experienced quite a number of cases is Mangochi, Blantyre, Lilongwe, Salima, and Nkatabe. When you look carefully at this, you find that Mangochi, Salima, and Nkatabe, they're all along the lakeshore. While Blantyre and Lilongwe, these are the cities. And in the cities where they are coming, particularly, they're coming in the slums, where mostly it's an overcrowded area. And in terms of housing patterns, they are so densely populated, and to find space for constructing a pitcher tin it's a toad, and it's sometimes difficult to do that. This graph shows in terms of the cases where they are concentrated. As I mentioned, Mangochi leads, seconded by the 2 cities, Blantyre and Lilongwe, and move on to some other districts. So in terms of fertility rate, of course, Mzimba South District really had quite a lot of case fertility rate of 14.3%, because the time that we had cases in Mzimba, there are some challenges in terms of managing the cases. Yes, so this is just to give a trend on how this has happened and in terms of stabilization. So remember, there was a decision to close the schools. So we had to look at what should be done, and the decision was made to suspend opening some of the schools, especially in those areas where we had lots of cases like Lilongwe and Blantyre. So we have some issues that we have taken note in the schools in order to prevent and control cases. But just to give you a picture of what is in terms of numbers in these schools. January 2022 versus December 2022 versus January 2023, in terms of the cases that affected, especially boys and girls, these are the numbers, and these are the teachers that were also affected. So at the meantime, it's not really a situation where it's out of control, but it's a number that gives us something that we need to concentrate on. So we did some responses to cholera in schools, and what we did was to come up with the SOPs, which we did something that we did with schools before they opened, that they should adhere to this standard operating procedures, and we had to distribute and orient all the schools. We have also done some sensitization and awareness through lots of media, like radio and TV. As I mentioned, that we had to make a decision to delay opening of school, to make sure that we prepare these schools so that they have a situation where they can be able to operate on by providing necessary facilities, like, for example, water supply, toilets and make sure that they have information available of them in terms of preventing and control of the cholera cases. So we have made recommendations, and the list is the following: provision of safe water supplies, which we are doing. We have intensified cholera prevention, management, and knowledge to schools. We do some periodic supervision to make sure that the school adhere to the practice. We have also established a real-time surveillance system for tracking cholera situation, especially in schools where we need to make sure that students, pupils are able to adhere to some of the practice and the situation is controlled. We have also made sure that we have gone through some of the decisions, especially on food vending, which we believe some of the source of infection is through food vending. So in terms of the ministry, we are repairing and rehabilitating water supply facilities, and also provision of sanitation facilities, especially targeting hotspots. We have done quite a lot of assessments to make sure that we have information on what is challenges in those schools, in various areas, especially in those hotspots. We have done some sort of limiters, especially in towns, in the cities, where the service provider for water supply is the water boards. So we have made sure that all the public institutions, they have water available, whether they have bills or no bills, but we have made it that we suspend or postpone payment of outstanding bills, and also providing support to schools to get advanced water tokens. These are the tokens for prepaid facilities. So we are also doing what we call water tracking with the available water tankers. We are tracking the safe water in two various areas, especially in the cities, where it's difficult for some of the people to get access to safe water. This is an expensive service, but still we have no option at the moment. We need to control the spread. We have also made sure that we extend the pipe network and also providing public standpipes and to construct more kiosks. We are also with the Ministry of Health doing chlorine distribution, what we port-to-port coordination. This is house to house, going to each and every household in the affected areas to coordinate water that they're drinking and to make sure that they have the knowledge on how to treat their home water. So we have also intensified the hygiene and sanitation promotion, especially awareness and sanitization campaigns. We have also put in place construction of new improved latrines, especially targeting public institutions. Let me mention that it's not easy for this one. It sometimes takes time to do the construction, but we are indeed having lots of challenges. Some schools, they have no toilets. Some markets, they don't have toilets. And this is a big, big problem. And we need to construct latrines or toilets in these institutions. Hygiene promotions campaigns in all public institutions. We are also trying to get together people that are leaders, especially those politicians and religious leaders, so that they are aware and they're sensitized and make sure that they adhere to the hygiene and sanitation practices. There are some religious leaders that they still believe in some other beliefs, but we want to get hold of them and make sure that we have enough information and they make decisions based on the information that they have. So there are lots of challenges that we are going through. The first one, financial resources. Resources is a big problem for us. You remember we have gone through just coming from COVID-19. Most of the resources were targeted and forwarding to COVID-19 prevention. We also had some outbreaks of polio, the floods that we experienced. All this required some resources, and now we have cholera. We need more resources, and the resources are to do installation and construction of water supply facilities and sanitation facilities. We recognize that there's poor sanitation and hygiene practices in most of the areas, and even the numbers that we have nationwide it shows the poor sanitation and hygiene practices. And for this, we need more resources to make sure that we improve our sanitation services and hygiene practices. And it requires quite a lot of things, apart from the financial resources, but even technical support. That could be something that is required, especially focusing on controlling and containing the cholera outbreak. I've already mentioned some sort of social, cultural, and religious beliefs that are taking us back. Some people, they don't want to treat their water with chlorine. They have their own thinking about chlorine. So this means and beliefs are setting us back. But the only way is to make sure that we have messages targeting, messages that are more behavior change sort of messages. We need technical support, especially in management and control of the pandemic. Whether the experience that others have or with similar outbreaks in other countries, if there is that technical support, this is the time for us to access. So there are lots of other things that we need. There's shortages in terms of case management, especially the OCV, low supplies, and that less. In terms of the actual budget, in terms of non-wash activities, we have a budget of over 19 million. What we have available is 7.5 million. And we have this gap of 12 million US dollars. For the wash budget, we have a 20 million budget. And we have managed through the partners, and these are just commitments, but one partner says, no, I'll be able to procure these supplies. Yes, we have put it together and it's amounting to 14 million. But this is not the money that we have. It's just a commitment. Somebody saying, no, I can do this. I can be able to support you this, but we don't have. So the gap, if we get the 14 million, then the gap is 6.5 million. So mostly this goes into wash supplies, hygiene promotion, and the infrastructure part of it. This is something that if we don't get some of the sources, then we will be difficult to completely control and contain this pandemic in the nearest future. So we need to do mostly we have the team, the personnel, our Ministry of Health. They have a network of extension workers. We also have experts in terms of constructing facilities, and yes, the NGOs are available. But most of the NGOs funds that they have, they are into their own development activities. But for this emergency thing is something, and we need to be in the mood of emergency. But if we don't get support, then it will be difficult to contain this. So this is the plea that we are making to each and every people. So what we need to do, apart from the financial resources that I've mentioned, I also mentioned about the technical support. This is something that is, if people have some technical know-how, if they have some experience on how they can control this, that's the resources that we are also looking forward. Thank you very much. Sorry, I was a bit. I was given about 15 minutes. I think it should be 15 minutes or something like that. Thank you very much, Dorcas, for the thing.
You're very welcome. You're very welcome. Thank you very much, Mr. Elias Chimulambe. You're very welcome indeed. Thank you very much for a very informative contribution, and also for bringing to everybody's attention the immediacy of the cholera problem, which is in the top of our minds, and the link to unsafe water supply, sanitation and practices and hygiene, the serious impacts on schools, on health, and the work that's being done in communications around that. The need, as you say, for financial resources, for sanitation and hygiene practices, and for technical support. So this is an opportunity for sharing, and it's an opportunity for people to go, actually, I know something, I know a piece of that puzzle, so I'll get in touch. So that's a great opportunity. So thank you very much. And I would encourage people to do what you can, if you have that knowledge or have some of those cards in your hand to play them, because I think it's a very important time for us to all bring what we have to the table. That links into the aspect of WASH very strongly, of water. And what I want to say is, if we can put up the PowerPoint, and we can go to the slide 3 on the PowerPoint. That would be helpful, thank you. So really, what we're going to talk about here is I'm going to give you a very, very brief introduction to key areas of water in Malawi. And I know that many of you will know all of these already. Some of you will be more heavily involved with some of them and less with others. But the reason we've put it together like this is to give the Water Forum a sense of structure. So we set out the areas, the 5 areas here are according to Malawi's commitments made at COP26, when it signed the Glasgow Declaration for Fair Water Footprints for Climate Resilient, Inclusive and Sustainable Development. And this was a declaration signed by 28 national governments, investors, companies, CSOs, academic institutions and support agencies, representing 185 million people and a combined GDP of $5.1 million. Malawi is a global leader in it, in demonstrating how to others how it's driving its delivery plan to meet its commitments for 2030 in these 5 areas of water. I know that Prince Mleta is on the call now. Given that he's got the joint water sector review that Elias is also involved with and Muti is also involved with, I'm very, very grateful that they've been able to make the time to come here today. And I would ask Mr. Prince Mleta if there's anything that he wants to jump in on any point of the presentation, please do so. We put it together just on the understanding that he would be very preoccupied with the joint water sector review, which was announced very recently and is running in parallel to this meeting. So the commitments are, as you can see on the paper here, I've put a little QR code there if you want to find out more about the Glasgow Declaration at a later time. But these commitments are in the areas of zero water pollution, and that doesn't mean no water pollution. It means no adverse impacts on the environment, water users, or functions from wastewater discharges, and control of diffuse pollution. It talks about sustainable water withdrawal, so that's about abstraction and use within the limits of sustainability, within the hydrological limits, not compromising the human right to water or the need of downstream communities or future generations. It talks about there are commitments made in flood, drought, and water conflict resilience. So looking at effective plans, policies, governance, and investment to mitigate risks of water-related disaster and conflict with legal compliance and water tenure for all. It talks about universal WASH, and it also talks about workers all having access to reliable and safe drinking water, toilets and washing facilities, and collective action reaching communities in need. It talks about protecting and restoring nature, about ecosystems and their services to be valued, protected, and sustainably managed, and nature-based regenerative solutions prioritized. So what it does is it covers these big 5 areas of water. Those are not the only areas of water. Many of you will be working in other areas that you say, well, actually, that doesn't fully represent what I do, or what I do straddles 2 or 3 of those. That's absolutely fine. This is only a structure just to provide a framework to talk about water within. So what I'm going to do now is just zoom very, very quickly through key water issues specific to Malawi that were identified, agreed on, and are to be addressed in Malawi's delivery plan, designed to meet the commitments of the Glasgow Declaration. And Malawi reports on this every year at COP. So it was at COP27 reporting on it, it'll be at COP28 reporting on it. I'll then invite all the speakers to give a brief outline of where they're involved and link to particular areas. And again, some of their work straddles several areas, and give you the opportunity to share what you're doing, either in the chat or in talking. So in my mind, I'm thinking of a map of Malawi where all the different interventions are showing up as little lights of different colours. And can we make connections and linkages between them? That would be a brilliant thing. Right, could I go to the next slide, please? So very, very quickly, I'm going to do this very, very fast. The one concerning universal access to WASH, as we've just heard in cholera, in the cholera outbreak, there is a very strong emphasis here on improving urban and rural WASH services for vulnerable communities. And it remains an urgent national priority to meet SDG 6. And all of you who are working in WASH, I'm sure that you can see that and that you're working very hard to raise that together. It also talks, one of the issues raised was also the WASH in the workplace. There's a significant opportunity to improve WASH via action in the workplace and in supply chains by investors insisting on that. Something that has to happen in every place they invest in, and in the public and in the private sector, to insist that human rights are respected as a reputational obligation of all companies to make sure everybody in the workplace has the right to water and sanitation. The next one is about zero water pollution. This one, the rapidly growing cities have quickly outgrown the wastewater facilities that are to serve them. And in densely populated unplanned settlements, on-site sanitation is hazardous. It's the emptying, the disposal, the flooding, lots of different issues that I'm sure many of you are aware of. The solid waste management problems are very visible, just being dumped. Collection, disposal are all problematic, particularly where it's toxic as well is an additional problem. Discharging, on the second point, discharging wastewater by companies, government agencies, industries needs a permit. And there are not always permits in place. The resources, both human and financial, to regularly monitor them are problematic. If the regulator is not independent, then they can be trying to fine another government entity who may be under the same ministry, so that's very difficult to do. And if the penalties are too low, if the fines are very low, then some companies prefer to pay the fines than to pay the cost of improving performance, because it's cheaper to pay the fine than to fix the problem. So that's also another problem in pollution. That's brought up in the Glasgow Declaration for Malawi, that Malawi itself has brought up. In the abstraction, licenses and permits reflect what's asked for on the application form. They don't always reflect what the environment needs or what the downstream user needs or how much water is actually available. There was some discussion around the computerized e-licensing system has had problems actually starting and running. It's been put in place, but there are problems with it actually being put into practice. There can be political interference. There was somebody who said we're not immune from being told who to give water to. And there can be conflict with smallholders and fisherfolk, for example, for who has the right to water when irrigators need it too. So a conflict of interest can be a problem in that. And there are systems to register and resolve grievances and conflicts in policies and procedures, but these are not necessarily effective. Sorry, we're on to the next slide, please. These are the systems to register and resolve grievances and conflicts in policies and procedures exist very much on paper, but they're not always effective in practice. Can I go to the next slide, please? Sorry to zoom through these, but this is just to give you a flavour of some of the problems raised under the different areas. This was done by different ministries and private sector and NGOs all in the same room to do this. Protecting nature, as I'm sure many of you have seen, waterways changing course or being so silted that they flood very easily. Water sources being eroded and deforested. And on the next one, environmental impact assessment, EIAs being done, but monitoring and following up on them to make sure they're acted upon can be tricky. Can we go to the last one, which is drought and flood? And I think that one's fairly self-explanatory in that we know that there are regular incidents of flood and drought, and managing and minimizing the impacts of these can be, there's room for improvement there. Building resilience with smallholder farmers as well is a really important part, being the backbone of the economy. Great, okay, so that, all I've done there is just whip through within the framework of the Fair Water Footprints Declaration, the issues that Malawi raised that they said, right, these are some of the things we've got to take action on. That's just to give a flavour of some of the problems that exist out there. And what we're going to do now is we're going to go to under these different headings. And again, they don't fit neatly. Everything isn't in a box because water, it can straddle several areas. But we've got a lot of guest speakers here who are very kindly volunteered to explain a little bit about what they do. And the idea is that then you can also put either in the chat, or we'll give you the opportunity after they've spoken to either raise any immediate questions or to explain very briefly what you do and where you do it and who you work with in doing it. Okay, so with that, Prince, I have whipped through that at lightning speed. Is there anything that you would like to highlight or would like to add to that?
Not really, Dorcas.
Great.
Just to thank you quite a lot for indeed highlighting the process that we've gone through right away from the time the declaration was signed 2 years ago in Glasgow by our Honourable Minister, and then the process that have taken place thereafter, engaging with all the necessary stakeholders in Malawi. We've got national workshops to try to solicit ideas on how we can go about the themes as regards the water footprint. So indeed, we are at the moment refining our delivery plan framework, which we developed together as a sector, as a country, and we hope to have it finalized so that it can we can move with speed with the recommendations therein. But otherwise, we thank you so much for the support that you are giving, and especially for preparing reports which have been given, especially even after, during the COP 27 in Sharm el Sheikh in Egypt. But unfortunately, I think maybe on our part, we did not attend because of some other challenges, but at least some could join online on some of the side events which took place. So I think we are rejuvenated, especially with the comments that our Principal Secretary, Mr. Elias Chimulambe, has also said in this meeting. We should be taking this further with my colleagues, especially Solomon, whom we've been key on this spearheading in Malawi. So without further much ado, I want to thank you and ask you to proceed with the agenda of the meeting. I thank you.
Thank you very much, Prince. That's very, very good of you. Thanks a lot. And thank you for coming in when I know that things are very, very busy. with you right now with the Joint Water Sector Review. Okay, with that, can I move immediately to Natasha Mwenda, please, from WaterAid, who's going to give us a little outline of what they're doing with under the heading of Universal Access to Safe Wash. Natasha, can I invite you, please?
Thank you so much, and thank you for the opportunity. I have a few slides. Am I allowed to share that?
Please.
Okay. So I'm just providing you an overview of the work that we are doing in Malawi, and I'll focus more on the WASH service delivery in healthcare facilities. So I think basically why WASH matters in healthcare facilities, because we are looking at providing a health and safety in the healthcare facilities, ensuring dignity, infection prevention and control within the healthcare settings, quality of care, and also helping management of disease outbreaks. We have a commitment that by 2030, we need to achieve the universal WASH, and this can only be done if we are able to reach everyone everywhere, regardless of the setting which the person finds themselves in. And we also know that for a health system to be trusted, there are certain provisions that need to be put in place so that people can now access the services, they can trust and access services on time. And I think you may be aware or not, in Malawi has one of the highest maternal deaths, and regardless that 90% of deliveries currently are happening at a healthcare facility, which means there are still some gaps that need to be addressed. And then we have also seen emergency of pandemics and outbreaks, which has put to test our health systems, and also I think awakening us to ensure that we have services and the healthcare facilities that are resilient. So we are providing WASH services in healthcare facilities. These include water supply, sanitation, hygiene promotion, as well as waste management. And we also look into sustainable management of the services that we provide, as well as the financing for future maintenances of the works, and as well as scaling up of these models that we are promoting in healthcare facilities that we are targeting. So as WaterAid, we are working in 3 districts where we have supported, especially with the funding from the Scottish government. But then we also have other donors that are helping us to support other districts. So currently we have 9 districts where we are doing WASH interventions in healthcare facilities, just to make sure that we provide a good and a safe environment for the patients. These are some of the photos that you may find in situations where there are no adequate WASH services in healthcare facilities, and the dignity of women is compromised. The safety of patients, if they are using alternative water sources, is compromised. But then if you are providing WASH services in healthcare facilities, you realize that you have now a healthier community, and also behaviors in terms of seeking healthcare, they improve. People now access timely healthcare services. So in our work, apart from the provision of the infrastructure, we are also integrating hygiene promotion in other public health programs like child immunization, or any nutrition projects, so that we can promote the good hygiene behavior practices. And we have seen having happy and motivated healthcare workers, because they are not worried of accessing water or working in a safe environment, as well as happy patients or clients who are also quick to access timely healthcare, because they know that they will access the quality of care that is a right to them. And these are some of the infrastructures that we have been providing in the healthcare facilities. Just to indicate that the recent outbreak of cholera has also put to test our health system, and we have seen calls being made to improve WASH in healthcare facilities. So in as much as we are supporting 9 districts, the gap is still huge, and there is still need for more investment to support the facilities. Thank you so much for the opportunity. And yeah, I think I'll stop here. Thank you.
Thank you so much, Natasha. That was really helpful and really informative. Thanks very much. What I'm going to do is, if you're involved in some of those areas, you know, physical areas that WaterAid is working in, or if you're interested to learn more about that, if you put a little message in the chat, then Natasha can see who you are, and she can link up with you, or you can link up with each other if it's people who are in different areas, but where WaterAid isn't present under WAF. What I'm going to do, just in the interest of time, is I'm going to ask to go through our 4 speakers' interventions first, and then I'm going to have the open the floor at the end of that. So I'm just going to go straight to Derek Mabasere from University of Strathclyde. So Derek, talking about alternative water supply provision models.
Thank you very much.
Thank you very much. Thank you.
Thank you very much, everyone. For the sake of time, I won't share slides, but I'll have them available if anyone wants access to them. My name is Derek. I'm from the University of Strathclyde. I work under, I'm a student under Dr. Tracy Morse. And my research looks at alternative water supply provision models in form of communal water kiosk. As we know, the research done by the Scottish government and the Government of Malawi under the Climate Justice Fund, the research found that about 22.3% of water points are non-functional, and approximately 22% are partially functioning. And we know that this puts a risk, a health risk to many households, especially in low-income areas. So my study looks at what is the alternative. Increasingly, we are seeing the promotion of what they call communal water kiosk, especially in peri-urban Malawi, areas like Lilongwe and Blantyre, and we are also seeing them in rural market centers. So what are communal water kiosks? These are basically outlets where water providers deliver safe and reliable water at affordable prices to residents in low-income areas. Sorry. Oh, I think it's
sorry to cut you. I'm dropping because I'm going for another meeting. Thank you very much, colleagues, for having me in the meeting. See you next time. I hope I will be able to know and you'll be able to share with us the outcome of this meeting. Thank you very much. Thank you, Dorcas, and thank you, Stuart. Tracy, thank you very much. Thank you all.
Thank you so much. Thanks very much for attending. It's very much appreciated. Thank you.
Thank you very much.
Thank you, and thank you. Derek, apologies.
I'll continue.
Yeah.
All right, thank you. So basically, these communal water kiosks, which maybe are a form of social enterprise, they have been found to provide all the attributes of basic water service. That is, water of good quality, appropriate quantity, accessible, and to be functional. But we also know that their success is dependent on consistent demand from the users and their willingness to pay for an improved service. But however, empirical evidence shows that they are experiencing what we call mixed payment compliance outcomes, that is inconsistent payments from the users. So my study looks at these payment behaviors at communal water kiosks. I'm particularly interested in understanding, what are the factors that influence payment for an improved service? What are the attributes that people value from communal water kiosks? How do these factors and attributes interact? And what are the points of intervention can we improve these water payments? So my study is we mainly did it in 2 districts of Palaumbe and Deja. We managed to find some water kiosks there, and we employed a system approach to be able to capture the dynamics that I've just mentioned. Our findings, I'm just going to outline our findings so that I'm in time. We found that household users do demand an improved service, but they are not always willing to pay for it. We also found that the level of water service changes with demand, and that water payments are influenced by the coping strategy that people use. So for instance, if they found that there is not enough water at the kiosk, what do they use? They use alternative sources, and this has an impact on water payments. During this time of cholera, we also found payments to have increased, maybe the scare of using alternative wells that they know might be contaminated. Most importantly, we found that water payments are influenced by context-specific socially embedded factors such as community organizations, trust in local leaders, sense of ownership, factors like social capital, reciprocity, trust in local leaders, and existing conflicts. So I had points of discussion, maybe people can contribute on the chat, where I was asking the question, what do some of the stakeholders here think are the other factors that influence water payments at an improved service, and what points of intervention do they think can be recommended to improve the operational sustainability of communal water kiosks? Thank you.
Thank you very much, Derek. That's very much appreciated. What I'm going to do, if you have some feedback, immediate feedback in the chat, then please respond to Derek's questions there. What I'm going to do, as I said, is group the speakers first, and then we'll open the floor to everybody following that. I'm going to move on now to the subject of water pollution. And I'm going to invite Dr. Tracy Morse from Strathclyde, if she would like to give us a little brief outline on what they're doing in that area. Thanks.
Great, thanks. Thanks very much, Dorcas. And it's been really interesting to hear all the speakers so far. Good morning, just here in Scotland. Good afternoon to everyone in Malawi. I think first, just to emphasise that the work that I'm talking about is very much partnership between not only ourselves here at Strathclyde, but also our colleagues, one of which is on the call today, Kondwani Chidzibusano from Washtead Centre at the Malawi University of Business and Applied Sciences, as well as the Malawi Liverpool Wellcome Trust, and other partners as well in the UK, like LSHTM and Stirling University too. So we see this very much as partnership engagements and the things that we're doing. With Washtead, we work across a wide range of things. You've heard from Derek, you've heard from Donald today as well, but myself and Kondwani very much focused on looking at the kind of wider challenges in WASH in terms of engagement and infrastructure, behaviour change, and how those can be used to leverage change across these different areas. But I said I would talk a little bit about water pollution today, and there are 2 particular programmes that we've been working on with formative research work over the last few years that I thought might be of interest to the group. So one of those is our current project with the University of Stirling called Spaces, which looks at the use of plastics, and also within that, their contribution to environmental contamination. The programme at the moment particularly focused in Durandi and Blantyre, and our component really is looking at understanding the challenge of informal waste disposal in that environment. Anyone who's worked in those areas know that informal waste disposal is extensive. It can be in the middle of the township area, but also on the riverine systems, and so is a huge challenge in terms of not only the contamination of the water itself, but also contributing towards flooding, clogging of water systems, and this is water that people are not only in contact with but often using in terms of washing clothes and for other household purposes as well. Maybe some interesting highlights from what we've seen so far, not happy insights, I would say, is that our team, we have an amazing team of researchers who go out and wade through waste pits in Durandi month after month. And I think what's been interesting to us to see in there, and perhaps not surprising, is the extent of waste disposal and the huge volumes, but actually there are certain key characteristics to that waste. So we see the small blue plastic bags, for example, as opposed to thicker plastics that can be reused and repurposed. And I think one of our other key findings has been the increase that we've seen in the number of disposable nappies that are being used in this environment and dumped in informal waste dumps as well. And I kind of, as one of our colleagues at Stirling has called it now, open defecation by proxy in terms of contamination, and definitely a significant problem. Our colleagues at MLW have been looking at the samples that we collect from these waste piles as well, finding a range of different organisms, including cholera, not surprisingly in the current situation, and typhoid. So this is a big issue, and our other colleagues across Durham University and Stirling are looking at the behavioural aspects and the economic aspects of how this waste is dumped. So we would love to hear from anyone within the group who's interested in this area. We're looking, we're working with partners like Waste Advisors on the circular economy and how we can look at this waste reuse and redistribution once we understand what it is made up of. So lots of opportunities, I think, for collaboration across different partners there. The other programme is one that has actually, the research work is finished, although we're still writing up, which was called DRUM. It was the Drivers of Antimicrobial Resistance, which was undertaken both in Uganda and Malawi. And that was looking at the issues around environmental spread of antimicrobial resistance. So often we think of AMR as coming from overuse of antibiotics and overuse of them within hospitals or antibiotic use itself. But actually what this piece of work has identified is that the antimicrobial resistant organisms are prolific in environments. In Malawi, that work was done in Cholera, Durandi and Chikwawa. So no matter the peri-urban, urban or rural nature of the samples and behaviours that we were looking at, we found antimicrobial resistant organisms throughout there, particularly again in riverine systems. So in river water samples were extensively contaminated, and obviously that has the knock-on effects, as Elias talked about in terms of cholera earlier, of contaminating vegetables within the market, going into the food supply and food chain, and spreading elsewhere as well. We have a number of publications out about that. I'd be very happy to share them. Now looking at what are the potential pathways and opportunities to try and reduce this transmission. And again, we're always really keen to talk to partners to learn from work that they're doing, but also look at how we can collaborate on pulling those together. So just some highlights of work that we're doing in that space. I know there's lots of other people doing fantastic work as well, Dorcas, and happy to chat more. Great, thanks. Oh, I just wanted to say, if Kondwani wanted to add anything, he's very welcome. I've forgotten something important, which is not unusual.
No, it's fine, Tracy, well presented. Thanks for that.
Would you like to add anything, Kondwani, or are you good?
No, I think it's okay. Tracy has really summarized what to expect.
Okay, perfect. Thank you so much. Okay, there's two really interesting areas. Health and environmental contamination, though looking at, is anybody working out there on Waste Advisors and the circular economy? Are they working around that area with that particular plastics pollution area? Anybody out there on that? and also the environmental spread of antimicrobial resistance, the whole issue of food contamination around that. Are there any opportunities to work together on that, or are you working in an area where you know that's going on, but it's not a direct part of your work? Do you want to flag that up? There's lots of opportunities there to share what we know. Thank you very much, Tracy. That was really very, very interesting. We're actually doing some work on plastics ourselves, so I might be in touch with you very soon. Okay.
Very welcome. That would be super. Thanks, Dorothea.
Okay, great stuff. Okay, I'm going to move to Muti, please. Next, who's really, thank you very much, Muti. He's agreed to give us some input into the area of sustainable withdrawal and equitable allocation of water, so about abstraction. So thank you very much, Muti.
Yes. Good afternoon, everyone, and I hope you're all doing well. I'm going to talk on the subject of sustainable withdrawal of water. Now, for the sake of this presentation, I'll be focused on groundwater for a couple of reasons. Firstly, I'm biased because I work in groundwater. So I want to make that very clear. But besides the fact that I'm biased, there's also the fact that groundwater is a significant asset for Malawi's socioeconomic development. According to the Ministry of Water and Sanitation, 75% of Malawi's population depends on groundwater for their general livelihoods. But also in terms of other water resources like rivers and streams, according to research done by the University of Strathclyde, 57% of annual river flows are groundwater dependent. So as much as I'm biased, all the data is in my favor. So there you go. So I'm going to talk about groundwater specifically when it comes to sustainable withdrawal. Now, what do we mean when we say sustainable withdrawal? Basically, it refers to the act of abstracting or taking out groundwater from the ground, and it should be taken out sustainably. And by sustainably, we want to ensure that that water resource is available for future generations. Now, there are many aspects of how that can be done. There's issues to do with conservation, with protection, but a lot of the work that I'm doing is around regulation. And with the regulation component, a lot of my time is spent working with the National Water Resources Authority, or in short, NWRA. Now, Malawi has a regulator for water resources, NWRA, and it also has the required laws. So there is the Water Resources Act of 2013 and also the Water Resources Regulation of 2018. So, and just recently, the National Water Resources Authority has actually undergone some recruitment to get new staff in place so that it can be operationalized. So we do have the pieces for regulating abstraction of groundwater, because the process for abstracting groundwater is fairly simple. You have to apply for a permit. Like if you're a drilling company in Malawi or an NGO and you want to drill a borehole in Malawi, you need to get a permit from NWRA. Once you get that permit, you have to go to the area where you say you're going to drill. Once you finish drilling, you conduct all the required tests on the site, you document all that information, and then you give a drilling report to the regulator as part of their record keeping, and also just to keep track of what is the condition of the water resources in the area you said you're going to drill. Okay, so we do have a groundwater process for sustainable withdrawal that the regulator is supposed to enforce. But what is the reality of that process? At the moment, what is happening is that a lot of drillers and NGOs do not get permits from the regulator. They simply go out there and start drilling. And as a result, you find that drillers are not being supervised to drill. That's another problem. So boreholes are being drilled in so many places of the country, and the regulator has no idea that they're there. Now, this is a major problem because we have no idea what systems are tapping from what groundwater systems, because that's really important in terms of knowing how much water is being taken out against what's coming in terms of things like rainfall and other things. Now, one of the major problems with this is that drillers are not being supervised, because one of the things the regulator does is to check that the driller who's drilling actually has all the required technical standards that are required to be adhered to. So the regulator does that. So if you don't work through the regulator, you take a driller who's actually shoddy at their job and they're not being supervised, the result are systems or water points or boreholes that don't adhere to the standards. Now, what does this mean? In my work, we found boreholes that when you conduct a pumping test on them, they don't last the required 4 hours that are required by the local standards. Most boreholes we found, some have lasted 3 minutes, 5 minutes, 20 minutes against the required standard of 4 hours. Meaning, if you pump water out of the hole, there should still be water inside the borehole, even if you pump consistently for 4 hours. And there are boreholes that don't last past 3 minutes. And this is a really common problem. I remember there was a community I visited of women who actually told us that you have no idea how much this NGO made us dance for this borehole that didn't last 1 week. And they actually said, you made us dance for this. And yet some boreholes don't even last 2 years, 3 years, and they're supposed to last up to 15 years. And a lot of this is because there's no adherence to standards. Now, just when you think that is all there is in terms of the problem, there's the additional problem of that drilling reports that are documented are not given to the regulator. Unfortunately, the regulator is not here, but Prince Mleta is here, he can confirm with me. But as of last year, World Water Day, the regulator only had 1 drilling report for the entire country. Now, how many boreholes are out there? 60,000. So NGOs are doing the charitable thing of giving people water, but those reports are not going to the regulator. And those reports are important because we get to know where are these boreholes, how much water is being taken out. And it's quite unfortunate because then the regulator cannot regulate if it doesn't know what's out there. And this issue of drilling reports is becoming quite a cumbersome issue because as part of the work that we are doing, we tried to get these drilling reports. In fact, there was one particular company we approached and we asked, can we please have the drilling report for this location that you drilled? And the response we got was, we can't give it to you because we have to consult our government. That drilling report belongs to the Malawi government. And yet there are companies in my country that are saying they need to consult another country to release a drilling report that belongs to Malawi. There are also other problems. Like, for example, we tried to use the Freedom of Information Act to actually compel certain institutions to submit their drilling reports. And to this day, about a year later, most of them, not most, all have not submitted. And the reason being, unfortunately, the Freedom of Information Act only applies to public institutions, not multilateral or bilateral institutions. So you see, Malawi has a process for trying to regulate the water resources. But at each turn, we have drillers that are showed here that are not registered, that are being hired by NGOs that don't comply. And then even when reports are produced, they are not with the regulator, so we have no idea what's out there. But what really grinds my gears is the fact that even when, like the borehole I told you, that doesn't last 3 minutes, even when these systems are installed all over the country, the NGOs or the drilling companies that installed them and proven that they didn't follow the standards are not held accountable. Go to any sector. If a doctor gives you bad medication, they can be disbarred. If a politician doesn't fulfill their promises, they can be kicked out. But when an NGO or drilling company drills a bad well, not following the standard, nothing happens to them. And the work that I'm looking to focus on is to try to correct that, to fix the groundwater development chain to make sure people are complying and that people are adhering to the standards, and those who need to be held accountable must be held accountable. And if you're interested in that kind of work, then please join me in being very unpopular. Thank you very much.
Thank you very much, Muti, for that excellent intervention there. That's really very succinctly put and very clearly put. For the drillers and the NGOs, the shoddy work, the NGOs not being compliant. And I think a lot of the donors, when they're giving money to NGOs, say, are you compliant with the country that you're working in? And they're just putting yes. Yeah. Do they know where they've got to be compliant? Do they understand the actual importance of that compliance? Because as you say, that determines how much water is there, how much can we actually allow people to take out for the longer term, etc. It's very difficult if you don't have that information available because people don't realize or aren't complying. So, so that's a really big signal there. Also, the government information that's critical to managing water resources just not being available from companies as well. Maybe there's some pressure that needs to be done there on the accountability side for the companies to actually raise that issue. And with the investors behind the companies. Sorry, Muti.
No, if I could just add, I mean, one of the things that we've tried to add, which I didn't mention in my talk, is that we have been trying to work with the government to try to, particularly district government, to try to get them to hold drillers accountable. And so far, by our experience and engagement, I think there's a hesitance. And from just, secondhand, conversations, informal conversations, I feel district councils feel reluctant to hold people accountable because they're afraid they'll lose money. NGOs will migrate or basically there'll be an exodus of money out of the district because they'll say this particular district council is too hard on us. But the district councils need to be hard on us because we need to be held accountable. So Absolutely. There is that fear among district councils that needs to be worked on. How we do that, I think it's the engagement that the part of the advocacy I need to figure out. And if anybody has ideas how we fix that, I'm open to suggestions. Yeah.
I think that's interesting also what you said about very early on about the heated discussions coming out of the joint water sector review about getting CSOs to play their proper role. And maybe that's about making that awareness among CSOs, a sort of peer pressure among them, that the compliance is absolutely, critical, whether you're working in health, whether you're working in education, whether you're drilling for a school, for a health centre, something like that. If you're not compliant with the law is there for a good reason, and if you're not compliant with the law, then if anybody has anything to say on that in the chat immediately, that would be great. What I'm going to do now is I'm going to open the floor to any questions or any interventions that anybody would like to add or would like to contribute in. Maybe it's something that they're doing themselves, or maybe it's something to add to something that they've heard just now. So I'm going to open the floor up. So just raise your hand and we'll pick it up there. I saw there was a question for Derek here in the chat. It was about, I think it was about the, let me go back to it. Where was it now? With the person who put it in there, there was a question for him on treatment. I think it was on treatment of the vessels, something like this. Sorry, I'm just trying to. Did anybody else? It was this.
Dorcas, it looks like Nathaniel Chimulambe has got their hand up, and Perfect. I think okay. That other question I can find it in the chat in the meantime, but it was from Jasper, yeah. I think.
Please, that's fine. Yeah. Okay, great stuff. Yeah, I think it was Jasper. Right, Nathaniel, please go ahead.
Thank you. Thanks very much, Moti. That was a very inspiring talk, and it really touched on areas that I have personally also observed in Malawi as major areas of concern, especially with the depletion of the aquifers in the different regions in Malawi. So my question really was, it seems like your discussion focused a lot on the bigger organizations that are undertaking, borehole drilling in the country. Yeah. On the other side, wouldn't you think also that maybe the private ones that are people sinking boreholes in their own private lands, it seems to be a huge industry as well, and I don't know how that balances versus the boreholes that are drilled, for the wider public by the NGOs and other organizations, because it feels like in places like Lilongwe or Blantyre, the main towns, I would argue that the water tables have gone down a lot, maybe massively due to private wells being drilled in these well-to-do areas. So what's your observation on that one? Thank you.
Thank you. I don't have data to speak to the comparison between the amount of abstraction that's there between the rural in terms of boreholes and urban, but it's something I can easily extract and we can have a conversation offline. But what I can say to the urban, I think one of the greatest risks, I think one of the major challenges in the urban areas, and those who live in Lilongwe or Blantyre, I live in Blantyre, one of the major problems is that water supply is extremely erratic. So you find that in some places people can go weeks without, days without water. So a lot of the problems we're seeing in terms of people having boreholes in their homes or within their compound is because they are pushed to do that. They are forced to do that. They're left with very, very few options. So, and that's the responsibility of the water board to try to ensure regular supply. I've been in forums. I won't mention which water board this is. I've been in forums where water boards have been asked, can you commit to 24-hour supply of water? This particular water board said no. Can you commit to 12 hours of supply of water? This water board said no. Okay, 7 hours of water. They didn't want to commit to any. So you find that even on that front, there's very little commitment or to being accountable in terms of the supply of water. Now, of course, I'm not criticizing the water boards. They do have their challenges, But a lot of what we're seeing in terms of people sinking boreholes in the cities, it's not because there's no, it's not because it's something they want. They're being forced to do that. So I think there's that element as well. I can't speak, like I said, I can't speak to the amount of abstraction compared between urban and rural. Yes, in some parts, I think it must have been Zomba where there were some reports that the water table is dropping, but don't take my word for it. I need to look at the data to actually speak authoritatively on the subject. My focus is mostly rural. That's why I can speak authoritatively on. But I can check data, I can access data on that, and we can talk offline, and I can give you a better answer.
Thank you very much. Thank you.
Yeah.
Great. Thank you, Muti, for that. Okay. I've come to the Derek. Are you responding to the question here? We've got Jasper said in the chat here, what define the location of the water kiosks, and do you have a procedure to disinfect the containers used to collect the safe drinking water? Derek, please.
Thank you for the question, Jasper. Well, in terms of selection of kiosk, we used contacts that we already had. We've done so much research in Malawi. And in terms of on the point use contamination, we know that most of the customers use their own container, and we are very aware that there is possibility of contamination there. But my study just focuses on their payment behavior and doesn't really go that far. But I also wanted to ask a question to Muti. I don't know. I just wanted to get his perspective that doesn't he think that what is driving, for example, private borehole drilling in peri-urban areas is the profit opportunities that exist? Because we know that these councils do not provide water, it's erratic, and people, vendors are selling water. They just drill a borehole and then they can sell it in unregulated prices. And what role does he think that formalized communal water kiosks could play in such a scenario? Thank you.
Yeah. Thank you for asking me a very difficult question. There's so many dimensions to it. Well, I mean, in terms of the kiosks, I think one of the challenges that the kiosks are having, and I don't know if you picked this up on your research, but I think my experience is more hands-on because I've dealt with water user associations, for example. I think one of the major challenges with, let me speak to the first part of your question. Is there a cost incentive? Again, I don't think there's as much a cost incentive in urban areas as much as there is in rural. I mean, there isn't a week that passes that you don't see an advert for people wanting to drill boreholes in rural areas. And the thing with the cost of water, or drilling a borehole in rural areas, you're looking at 4 to 5 million. If you want to drill in the urban areas, people normally negotiate it down to 2 to 3 million. So in terms of the profit margin, I think depending on distances, of course, there are so many variables when it comes to cost, but I would say the profit margin for most drilling companies is much higher in rural because they can charge more. And NGOs are willing to pay, by the way, especially with devaluation. You find that for the same dollar now, it's different. So you find that NGOs are willing to pay the 5 or 6 million it costs to drill a borehole because they have to deliver. So that's what I would speak to the cost element. My educated guess would be the profit margin is much higher in rural than it is in urban. Now, in terms of the water user associations, I think I was a big fan of the water user associations when they started because they were making money, they were extending systems, and so on and so forth. There was a lot of potential there. But I'm gradually becoming a disbeliever. And I'll tell you why. Because I know this will sound bad, but the thing about the water user association, the moment it starts generating revenue, it attracts political interference, and the communities are not strong enough to push back on that political interference. Community-based models I don't want to say they don't work, but they have too many challenges. If you make it a private model, then where you have a business person who's running the system for profit, I think that might stand a better chance than having community people who are not doing it they're just doing it at cost, who are easily influenced by politics. So It's slowly but surely I'm becoming a disbeliever in the Water User Association model as it is now, which is based on communities being the ones to manage. And okay, politicians aside, you also have the challenge of communities themselves circumventing governance structures to get money out of the system. I'm not kidding. There was one particular example of a war in Blantyre, Water User Association in Blantyre, where the board of the Water User Association wanted to have a meeting and people were demanding for transport reimbursements when they lived 5 minutes away from the meeting place. Now, you know, yes, so yes. So you have problems like that, where the governance structure is top heavy and is consuming too much money. But if you have a private model, the person has an incentive to try to be efficient. In the WUA model, the communities have no incentive to be efficient, none. So I am slowly becoming a disbeliever. But like I said, I'm willing to be challenged on that. But from what I've seen and observed, being in the sector for almost 12 years, it still has a way to go.
Yeah. Honestly speaking, the challenges that you raised, these are the same findings we found in my study, regardless of the opportunity that exists. And we're advocating for example, professionalism in terms of governance.
Yeah.
In terms, yes. Thank you very much. I appreciate that. Yeah.
Okay, great.
Perfect. Thank you. Have we got any more hands up immediately? Or is there anybody who would like to, who's working directly in a certain area, in any of that touch on any of these areas, in WASH, in abstraction, or in pollution, that they would like to chip in, tell us a little bit about what they're doing? Any immediate response? Okay. I don't see any hands up. So what I'm going to do is I'm going to move to the next section. First of all, do we need a little quick 5 minutes comfort break for anybody at all? If so, stay online, but we can do that if you all come back just in 5 minutes. If anybody needs to just jump out for 5 minutes. Here in the UK, it's 12:17, so we'll come back just at 12:23, something like that. Just quick, if you need to, but please don't leave us, just stay with us. We've got 3 more. I've also had people suggested to me to say, oh, there are other interesting people on the call that I'm going to call in at the end there if we have time. Okay, so if everybody can come back on at 12:25 if you're in the UK, and I believe it's 14:25, 2:25 if you're in Malawi. Okay, stay on the line, but just you put yourself on mute or close your camera or whatever if you just need to nip away for 2 minutes. Okay. Great stuff. Are we ready? Is everybody back? Have you had a comfort break or grabbed your coffee? Everybody ready? We're ready to proceed with the next part. Okay. I'm taking the silence as a yes, but I'm not sitting on my own out here. Right. Okay, for the second part here, can you just turn your cameras on just so that we can, so that I can see that you're there? Okay, Alan, I can see you. That's great. Okay, just to make sure that we're all around. That's great stuff. Okay, super. Okay, fantastic to see you all. Brilliant. Okay, that's super. Right, for the next part, again, just hanging on that same framework that was in the Glasgow Declaration, but again, it's not the only framework there is. But what I'm going to do next is invite Gaia Marini, my colleague and water witness. She's going to speak to the protection of nature and the resilience to drought, floods, climate variability and conflict and water conflict, just with a brief outline of what Water Witness is up to in Malawi. So that's just a very quick run through from her. So if I can go to you, Gaia, please.
Hello, everyone. Thank you for the wonderful talks so far. It's been really interesting. So for this portion, I'll be talking about protection of nature and climate resilience. And first, I will go through a couple of those points that Dorcas already mentioned at the beginning about what are some key issues that we've observed through our work and through the Fair Water Footprints work in Malawi, and then propose a solution to some of these issues, something that Water Witness has been working on for a while now in Malawi. So in terms of protection and restoration of nature, we've found that one of the key issues is soil loss and siltation of the waterways, which essentially means that the soil is eroding and it ends up in the waterways. That has a lot of consequences, negative consequences in terms of water quality, water availability, but also, for example, worsening flooding events. And this seems to be caused mostly by land and water use planning and regulation that is not always implemented strongly, like Muti was saying with groundwater. Just the planning around water use and land sometimes often results in development that is not sustainable in the long run, and in this occasion causes, for example, deforestation and erosion. Another key issue to do with climate resilience is, as we all know, regular floods and droughts in Malawi have been having a devastating impact. And just about a year ago in southern Malawi, Storm Anam impacted the lives of hundreds of thousands of people. So we're all very aware of this impact. And unfortunately, the action to plan, manage, and mitigate these impacts should be dramatically improved. And building resilience should start from smallholder farmers, so the backbone of Malawi's economy and food systems, and in key sectors such as water, energy, and transportation to secure Malawi's sustainable development. So addressing some of these points is, for example, the concept of water stewardship. Water stewardship is an approach to water management that looks at the catchment. So it's working with water users, all kinds of water users, to see how their water use impacts other people beyond the fence line, beyond their backyard or their farm, and looking at the whole catchment. And it's a holistic approach. So it looks at pollution, kind of the themes that we're talking about today. So pollution, sustainable water withdrawals, access to wash, so toilets and taps, protection of ecosystems, and good governance, so strong respect of regulatory systems. in this aspect, Water Witness, over the last 5 years, we've worked with agribusinesses, smallholders, schools, healthcare facilities. So this is very much an approach that can be adapted to all kinds of contexts. And we've had about 6 case studies now, maybe 7 actually, because we recently added a new one in the Mulanje area, working with tea farmers, sugar farmers, rice farmers, hospitals across the country, so from especially in the north and in the south. And this work looks at assessing the water risks and coming up with action plans, participatory action plans that the community and the water users implement to improve their water security and climate resilience, which so far has benefited about 26,000 people and counting. And one of the benefits of this approach is also it has established Malawi as a center of excellence for water stewardship regionally. So Malawi was the driving force behind the Fair Water Footprint Declaration, and some of these stellar examples of water management were the inspiration behind the ministry signing up to the declaration and showing Malawi's strengths in water management. And they also offer an opportunity, this approach also offers an opportunity to investigate the governance systems and really understand where the bottlenecks are. So if we have good regulations, why are they not getting implemented, and where are those bottlenecks that prevent action and proper implementation of water management? And so then having that information through advocacy, benchmarking, knowledge sharing, trying to address those issues. And it also has led to regional participation and leadership for uptake of water stewardship in Africa and in the region more widely. So through Malawi being a leader, sharing the knowledge and stimulating action in the region, not just in the country. So yeah, that's very briefly on protection of nature, climate resilience. I went very quick, so if anyone has questions, please do ask. And I did have some questions for discussion just to generate people ideas, but I don't know whether, Dorcas, you want to do that now or later.
I think if you just tell us what the questions are, then people can ponder them, and then when we come back to the open forum, then perhaps we can get some nice responses.
Nice, yeah. So the idea is the intersectionality of water and other sectors. So just thinking about whether you work or know of any initiatives that touch on water and protection of nature. So whether you're working in forestry or in agriculture or in other sectors, how, or even in schools, how does that protect nature? How, if you know of any initiatives or you work in any initiatives that have to do with flood and drought preparedness, whether they're health or education as well. And finally, thinking about the concept of water stewardship, the holistic catchment level concept, how can health and education initiatives support that concept, but also how do you think the water stewardship approach can support other initiatives such as health and education? So trying to activate those links between topics that might look different, but they're actually very interconnected. Great, thank you very much. So if you think about those points, and when we open the floor, we'll invite you to give some examples from the work that you're doing. Thank you very much, Gaia. I'm going to move to Donald Robertson now from the University of Strathclyde, who's doing some interesting work on citizen science and water under the heading of information gathering for water, a really critical part of the whole scene of water management. Thank you very much, Donald.
Thank you, Dorcas, and thank you for being invited. It's nice to see a few familiar faces on the call, as well as lots of new ones. Just by a quick way of introduction, so as Dorcas said, my name is Donald. I'm based at the University of Strathclyde doing a PhD, and I'm also a hydronation scholar, which is a Scottish Government doctoral training program. My research is specifically looking in and around the use of information and data in water, looking at kind of sustainable management practices. And I think on reflection, this forum's been a great illustration of how important data and information is to all work in this space. So we've had, everything from the very beginning. We talked about cholera and the importance of data and tracking cholera outbreaks, and we've looked at SDGs, there's stuff on water footprints, Muti's conversation around regulation. All of this work sort of relies on data and information. If there's going to be progress made, it kind of relies on having a good understanding of what the baselines are now and then tracking progress. So my interests for a while, I've been working in and around the Malawi water sector for the best part of 6 years. And I've thought a lot about the role of data and information. My research specifically looks at citizen science. So this is the participation of non-experts or non-scientists in research, and how that potentially is a source of novel data generation, and kind of promoting good data management practices. I think this forum has been a really, it is good, a great demonstration of how varied lots of work in and around water can be. And I think then one of the challenges with that is what you tend to see, and it's not a Malawi only sort of problem, is that you get this propagation of, there's so much information out there. It's quite often hard to find and access information that is coherent, or people produce duplicate sort of sets of data, and things like that. So I think as a forum, as a discussion point, I think there's a lot to reflect on, looking at priorities for data and information, and how we use and generate and share and work collaboratively. I think that's, there's a much bigger problem there that, much far bigger beyond than the kind of relationship between Scotland and Malawi. But it is really interesting, I think, to see the whole range of projects that just between Scotland and Malawi we're working on that all touch to that sort of point. So that was a very brief introduction to the sort of things I'm interested in. I'm happy to discuss any of that further, or if there's questions and things like that. But otherwise, I'll hand back over to you, Dorcas. And thank you very much.
Great, thank you. Okay, do we have any hands raised? Any initial points that people want to chip in? Any questions anybody has? If we don't, I've got a couple of people who have said they're quite interested in saying something, so I'm going to put you a little bit on the spot. If you don't want to, then just shake your head and say no thanks. But Alex Gerard, would you like to tell us a little bit about, from Tieni, the kind of work that you're involved in that concerns water? Are you with us? Or are you shaking your head vigorously? Do we have you still online? Or have you had to drop off? James Kitt. Okay, are you with us?
I am, yes. Hello, thank you very much.
Would you like to jump in?
Absolutely, yeah. No, I'll
Thank you.
30 seconds. Thank you very much, Dorcas. Yes, so for as way of introduction, I work for a UK Malawian NGO and social enterprise called Pump Aid, and our social enterprise is called Beyond Water. It's our 25th anniversary of working in Malawi this year, and we've have the sole focus of working in WASH. And over that time, I suppose one of the things that has stood out to us is the high non-functionality rates of community water points. Speaking a bit to what Muti was talking about earlier, and the kind of autonomy of NGOs, implementing NGOs, we found kind of a lack of sustainability to a lot of community water points. They'll be installed and funding may last for 3 to 5 years, as institutional funding windows do. And community-based management will only go so far in paying for the onward upkeep of community water points. So what we're trying to do through initial pilot phases and now through our social enterprise is to enhance the CBM structure of community water points, increase the capacity for water point committees to pay and collect user fees. And then as a subsidized model through funders, we recruit and train area mechanics to perform routine maintenance, quarterly maintenance visits to those community water points, and replace small fast wearing parts, and all for one fixed price. So the communities know how much they're going to be having to spend for reliable access to water. We guarantee repair within 72 hours of reporting of a breakdown, and it doesn't lead to this kind of unsustainable model of communities not being able to afford routine maintenance, small fast wearing parts going unnoticed, and then bigger, more expensive breakdowns occurring, and this kind of cyclical nature of rehabilitation and failure within the water point system. So that's one of the three things we do. As an aside, we also do early childcare development, so water points and sanitation within CBCCs, and we manufacture and sell low-cost household and irrigation pumps to smallholder farmers as well. So thank you for giving me the chance to introduce ourselves, and the discussion has been fantastic. And I know in previous years we've worked a lot and with the University of Strathclyde and Baseflow and other people on the call so we're all kind of pulling in the same direction, which is great.
Great, excellent. Thank you very much, James. Looking through the people who are here, Sydney Burns, I know you're doing a lot of exciting work in Malawi. Would you like to tell us a little bit about what you're doing?
Thanks, Dorcas.
Hi.
I wasn't really planning to say much, but I can just say a few words. Basically, as I said in the chat, I am a PhD student in Stirling, and before starting the PhD here, I was in Malawi working in the water sector for quite a number of years, and had noticed a lot of the issues that are still coming up in today's forum, actually, around water governance and just how different actors work together or don't, and why that is, and what the outcomes of that basically are for, or what the implications of that are for the environment, but also for people. So my research is focused on looking at who makes decisions and why, and who's part of decision-making forums, and who isn't, and the implications of that. And yeah, I won't say much about the specifics, but I mean, I am looking at what I have done so far is putting together some of the knowledge from the last many years working on this, for putting together stakeholder maps, and I'm going to be doing some social network analysis with that, looking at where power lies within that and different communication lines, and some of the things that Muti was talking about around, where is the accountability in that, and why, and what actually drives day-to-day actions of people who work in the sector, and not just, what are we supposed to be doing? Oh, well, they're supposed to be doing that, or they're supposed to be doing this, but like, what are people actually doing and why? And can we start to adapt what we think should be happening to what is happening, rather than just saying we should change how everyone else is doing stuff? So anyway, that's not very well thought out, but on the spot, that's what I have for you. But this has been really great to hear what other people are working on, and I would love to hear more. So yeah, thanks for inviting me.
Thank you very much. Thanks. And I appreciate that you're willing to speak on the spot like that. So thanks a lot for that. That ties in a lot with some of the accountability work we're involved in. So that'd be really great to catch up with you. It'd be nice to actually sit down together at some point. Be really great. Okay, Derek, you've got your hand up. Would you like to come in?
Yes, thank you. So I have a question for James. I think that's yes. So I wanted to ask James, if I heard you correctly, you are trying to implement an institutional arrangement, maybe professionalized maintenance, where maybe communities can sign a contract with a service provider or an area mechanic who does preventative maintenance. But this sort of strategy relies on communities willing to pay to access water. To what extent is this approach immune to socially embedded factors such as norms and the availability of alternative sources such as rainfall?
Thank you, Derek. Yeah, so to come back on that, I suppose it also depends on the functionality of the water point in the first place, and there's a lot of water point committees that don't have functional or adequately functional water points. So that's the kind of basic level we need to get to before we can kind of adopt the professionalized repair and maintenance arrangement with them. But there are social norms that we're acting against, and we do a lot of local advocacy with village leaders and water point committees to change the way that people think about water access, particularly in rural areas. So a lot of people still see it as a free commodity, whereas the structures within urban centres and the piped water systems people are paying for. So we're trying to move people and shift the perspective of local communities that that maybe access to water is a universal right, but the provision of that is something that needs to be paid for, albeit at a subsidised and affordable rate. And so that's a little bit on the norms, and we work on the other side of things with the local district water offices who lack kind of capacity, I suppose, to provide a universal basic coverage of water within rural areas. And what we're saying is, we're providing an accountable and very transparent service, both for the district water office, but for communities, so they can see exactly how their user fees are paid. And what we do if we incentive part of the fees that they pay further incentivize area mechanics by paying them a better income. So we're moving area mechanics away from that kind of quasi-volunteerism that they've experienced to date, but also any kind of surplus at the end of the year that hasn't been spent on repair and maintenance gets rolled over. So it's a very transparent service, and they almost appreciate the fact that they're no longer they're not doing the implementation themselves. Then the water point committee are then moving to being more of a client or a customer, I suppose, of us, and it takes a lot of pressure off of them to be able to kind of manage their water point committee and the provision of water. So we see ourselves as a service provider yet, and hopefully one that provides transparency and accountability both to governments and to customers.
Okay. Thank you very much. Thank you very much, James. I'm going to take a question now from Simon Msukwa, sorry. And then I'm going to invite Alex Gerard to give an intervention. Simon, please.
Thank you so much. It's not much of a question because I work with James in Malawi.
Right, okay,
and,
okay. And additional points.
Yes, it's just some additional point to say sure. That Malawi still has a village level operation and maintenance system where we rely on water point committees to collect money that is kept for operation and maintenance within the committee. What Beyond Water is doing now is to say, can we get part of that money, preposition suppliers for you so that we're able to repair the water points within the record time before 3 days elapse. So it's not asking them to pay because they're not already paying for our operation and for our operational costs, but that we are saying water boards in the urban cities are highly subsidized. What is the strategy for rural water? And maybe making a case in the future that if we are indeed going to succeed in having continuous access to safe water with sufficient quality and quantity, we will need to invest in the rural system. So we are basically saying, for now, we are like a water board for hand pumps, which is not a structure that is there. And just to juxtapose two scenarios where we have urban water having the responsibility taken to the water boards, while rural water were saying, can you organize yourselves and pay for everything on your own? So we think we need to move towards where they can also access the professional service of them just giving out the money and saying, yes, we have 15,000 that we give to an area mechanic, and the 65,000 where we buy spare parts, and each time we use each of those, an O-ring and a foot valve, whatever, we deduct and say this is the balance. So the model is something that we are trying out, and of course making a commitment that we have the district council coming to monitor our work on a quarterly basis to ensure that what we signed up to, that 95% of the water facilities would be functional at any given point in time, is indeed the case. So it is work in progress, but I think some interesting parameters are coming out, and where we now need to focus so much is how do we mobilize the water point committee and the committee community members to raise enough money to be able to subscribe to the work that we do. And also, in case we have major breakdowns, how do we deal with such situations? So yeah, I just wanted to supplement what James was presenting. Thank you.
Thank you so much, Simon. Much appreciated. Thank you.
You're welcome.
I'm going to invite Alex Gerard very briefly to give us a small intervention here on their work.
Hi there. Thank you very much, and apologies, I had to take a call early, and I apologize missing your invitation. Yeah, so I work for TNE. We're an organization based in Mzuzu, but working across Malawi. We're an agricultural charity, but we've developed a type of farming called deep bed farming, which addresses the issue of soil erosion, but also water harvesting at a very local level. So deep bed farming, one of the core elements of it is breaking up the notorious hardened pan that sits below the surface. Most traditional farming only tills to about 20 centimeters, but the hardened pan, particularly in Malawi, is more like around 30 centimeters. So in year one, we break that up, and that is critical, because what that does is allow water and air to reach further into the soil and allow for natural processes to improve the crops. You can see from the picture behind me, the crop on one side is traditional ridge, and on the other side is deep bed farming. No chemicals used, just an improvement of how the land is managed. But as far as water harvesting, we also create basically ditches within, and they're capped throughout the field. So every drop of rain that lands is then captured and then seeps down through now the broken up hardened pan and is critically topping up the aquifers. So our work now, we're trying to align a lot more with pump projects, with boreholes, making sure boreholes are drilled in the correct place, and working with partners to achieve a nice synergy between the work we're doing to improve crop and water harvesting, but also then providing water for sanitation and domestic use, and at source, not having to travel long distances. So it very much aligns with the work that we're talking about today.
Brilliant. Thank you very much. And I hope with the pump projects, it's not only if they're in the right place, but if they're compliant with the...
Yeah, absolutely. Yes, as we know. So we work with partners who do go through that process, but it was a very interesting talk on that, and we'll continue to make sure they're always compliant and always being recorded correctly.
Yeah, it is really critical. Yeah. Okay. We're interested in the work you're doing, and because we're working, as Gaia said, with farming cooperatives, so that can be very interesting to link up with you of the work we're doing in water stewardship, because there might be some interesting crossovers.
Absolutely, I'd be very interested to talk about this. Yeah.
Okay, great stuff.
Great.
Good stuff.
Thank you.
Any immediate hands up, or anybody feel like I wish you'd ask me, because you haven't yet, and I actually want to say something? Because you're very welcome. Okay, on that front then, I'm just going to go to what next? You know, that was a really great opportunity to bring everybody together to say what's going on in water in Malawi. Thank you very, very much to all the speakers, really interesting. And I love it when people are asking a question across to somebody else in the meeting, because that's like the good old days when we were all in the same room. So that's really nice. So thank you very much indeed. What we brought everybody together for really here is opportunities to learn more and to link up with others. So I hope you've either been making some notes, or you're going to listen back to the recording going, oh, somebody said something interesting, I just want to find that bit again, where I'm going to link up with them because there's something I want to follow up on. So that's the critical part of the meeting. If you want to know more about the structure we use, the Fair Water Footprints, that type of work with the Glasgow Declaration, you've got the little QR code there. And I think there's a link in the chat as well. So you're very welcome to find out more about that. If you want to connect up with WestNet, which is the water network in Malawi, they are linking the water NGOs together. We're also linking with CISANet, the agricultural network. There's some good networks out there to get to know. So if you're not already doing that, that's worth doing. So there we are on, that's what we aim to get out of this session. So we're not trying to solve one specific problem, we're just trying to share what's going on out there and where we can link up our work. Right, before I pass back to Stuart, I believe there's 2 poll questions that are going to come up on your screen from SMP, from the Scotland-Malawi Partnership. And they're very, very easy. So please, I know when people sigh when they say, oh, do I have to do an evaluation? And I find when people ask you after everything you seem to buy nowadays, did you like that? Then people go, no, no. This is a very, very easy one. Just 2 clicks and you're done. If everybody can do that for us, that's super. 2 clicks and you're completed it. And with that, I will now hand back to Stuart with a very big thank you to all of the people who participated, all of the people behind the planning. I really, really appreciate your work. Thank you so much. Thank you.
Thank you very much, Dorcas, and thank you very much, everybody, for making time today for such a stimulating sharing of issues around water. Thanks to our speakers, Elias, Prince, Natasha, Derek, Tracy, Muti, Gaia, and Donald. It's been brilliant in this meeting to hear practitioners saying that they're planning to come together to collaborate further. Thanks very much to you, Dorcas, for all your effort in designing this meeting to be so open and so relevant. My thanks to the team here at the Scotland-Malawi Partnership, to Jade, to Chad, to Alan, but most especially today to Dorothea, who's driven the Zoom tech so effectively and efficiently. In brief, AOB, relevant to the topic of cholera, the Scottish Government's Minister for International Development, Neil Gray MSP, last week approved a request from UNICEF to pivot to reallocate just over £236,000 of funds previously allocated for the purchase and supply of an oxygen generating plant to health system strengthening activities as requested by officials within the Ministry of Health in Malawi. And finally, just to invite everybody to an open and inclusive health forum on the 15th of February, focusing on cholera. We'll hear from the co-chair of the Presidential Task Force on COVID and Cholera, Dr. Wilfred Chalamira in Coma. And all the information on that and to sign up is on the website, and I've posted the link to register in the chat there. It's a hybrid event. It'll be held online like this on Zoom, but also if there's sufficient interest for people to turn up in person and have that face-to-face networking opportunity as well, we'll also hold it in Edinburgh City Chambers at the same time. But for now, thank you very much indeed. That's the end of this meeting. We'll follow up by sharing a video of it, the chat log, and by pursuing the next steps outlined by Dorcas. Thank you and goodbye.